So, yeah, we'll start with a new remedy. Before I start introducing, I just have a small clip, and I feel this clip will give us a lot of clarity. What I was trying to ask you, or what I was trying to tell you here is, see, when we look at the sources and the sources of homeopathy, or sources of homeopathic material medica, what comes to mind? Sources of homeopathic material medica. I know this is not a question I should ask a PG scholar, but the topic is something related to this, so that's how this image is here. What are the common sources that comes to mind? Okay, you have, what is it? Human toxicology. Okay. So you have plenty. We'll not go into the details because it's a first year topic. So what I was trying to tell you here is, when many great authors compare homeopathic material medica to an elephant, and homeopaths or homeopathic students to the blind men. So what is this understanding you have here? What is this understanding? Why is homeopathic material medica referred to an elephant? And why many times it is told the blind man could be a homeopathic student or a homeopathic teacher or homeopath himself? What is the understanding here? You know the story, like for example, story where elephant, and some blind men were about to test the elephant, and they were asked, what is it? Somebody who touched the trunk felt it is more of a snake. Somebody who touched the, what is this? Tusk. They felt it is more of a spear. And somebody who touched the ear felt it is a fan. Okay? And the other blind man, who was feeling the tail, he felt it is more of a rope. And you know that it is a single entity and it is an elephant. So why this example, many great homeopaths they have used here is because, this is what I was just trying to tell you, because homeopathic materia medica is very vast. Fine? I hope I am clear now. So homeopathic materia medica is very vast. Many of us read probably a part and we have our own imagination. We will never bother to look into the entire picture because we have a feeling that material medica is very, very vast. And probably this will also give you an insight. This might be a little exaggeration, but if you just look into the next slide that I am trying to tell you, what is this I am trying to tell you? Very good, very beautiful, good. Books? Yeah, books. Okay. Different material medicas. Right? Because the class is material, and I challenge the maximum books we have in any homeopathic library will be material medica. Okay, I hope you all agree. Tom, Dick and Harry, tomorrow even yourself might be writing a book on material medica. So there are a lot of books. Anyway, it's a good thing that we have so many authors who have written material medica, and they have contributed to the vast homeopathic material medica. So what I was trying to tell you is, see, all these things, as a material student, what do you think? What is it that it is leading to? So many books, so much of knowledge, so many things. What exactly it is leading to? It is leading to the vastness. Many of them have this feeling, the material medica is so vast. And many of them don't venture exploring this vastness out of the fear because material is vast. And we become prejudiced. Okay. So now the question is, why the material is so vast? Why there are so many material medicas written in homeopathy? Any quick inputs? Yeah, very good. Netra says, each homeopath, the way he understood materia medica might be different. Good, possible. Any other inputs? Okay, so what you have to look at is, as we evolve, not from ape to human being, as we evolve in homeopathy, our understanding of homeopathic material medica also evolved. So So as this knowledge increased, as a material teacher or as a homeopathic doctor, we try to come up with lot of inputs, our ideas. Now how did these ideas come up? These ideas come up. Okay. So I'm just quickly taking you through the evolution of homeopathic materia medica. From materia medica pura to the latest materia medica that we have, they have all contributed beautifully. And each of us, according to our capacity, we pick books. Few of you might be very comfortable with Allen's keynote. Yes, agreed. And we pick up Allen's keynote. Information given in Allen's. And few of you might be very comfortable with Kent's way of approach. Yeah, you pick up Kent's way of looking at things. So each of us are different, and according to our comfort levels, according to our understanding, we pick up others. Okay? So what I was trying to tell you is, see, with the process of evolution, this is very important, lot of authors belonging to different eras, with the availability of resources, try to make homeopathic materia medica more interesting and more practical. Okay? So, what is it that I am trying to tell you is, see, with the knowledge of emerging sciences, what do you mean by emerging sciences? Like, knowledge of psychology, very good. Knowledge of chemistry, very good. Any other knowledge that you can think, any other science? Pathology, okay. With advancement in the knowledge of chemistry, with advancement in the knowledge of psychology, you have told this, toxicology, very important. Comes close to what Krishnadas was insisting, and with the knowledge of pharmacy. Okay? Or many more. We homeopaths have tried to use all these things to make our materia medica more approachable, our materia medica more reasonable. Okay? So, yeah, every homeopath, they try to apply all these things so that their main motto was to make homeopathic materia medica more easy and more comprehensive, because of which we have so many materia medicas. Okay? So this is the quick explanation. Now I will come to the topic that I want to discuss. Now before this, okay. I mean, there was one more slide. Yeah, must be. We'll just see. We'll just look into it. So metals. We were talking about metals. I was just speaking to Sharma Prasad, your pharmacy teacher, and trying to understand how the source, if you're looking at sources of homeopathy, they're different. What are the sources of homeopathy? You have plant, animal, mineral, infodemia, salts and losses. 6. But when you're looking at 7, there's one more. So when you're looking at homeopathic materia medica sources, you have plenty. So I was just trying to get in touch with Sharma Prasad and try to understand how can we classify metals. Okay? But when you look at the minerals given in your pharmacy text, you have a very elaborate classification. Okay? That elaborate classification for today's class is not required. So metals, which are part of the mineral source, for a PG scholar, for our class, how can we classify metals? Simple. I don't know if it has some logic or not, but for our understanding, what would be the simplest way of classifying metals? Beginners. What would be the simple way of classifying metals? I am again trying to tell you, not from the knowledge of chemistry. Simple classification. I got the right word there from that end, but can you think of some simple classification? Okay. Anything better? Metals, we classify them into heavy metals, noble metals. Okay. Or another simple classification, hard metals. Okay. Hard metals, and can you give me some examples for hard metals? Ferrite, iron, copper. And another way of classifying metals for our homeopathic understanding is soft metals. Examples for soft metals? Alumina, mercury, and zinc, stannum. These are all examples for soft metal. See, hard metal, soft metal, their chemical properties, their physical properties, and their application in homeopathic materia medica. I mean, that's a different task. Okay? In today's class, we'll be focusing on what we call it as noble metals. What we call it as noble metals. Okay? So, any quick input from your end? What is a noble metal? Examples for noble metal, and in homeopathy, what are their utilities or what are their uses in homeopathy? Noble metal. Okay, I mean, why are they called noble? Because they're precious, they're expensive, and good, possible. Anything else? Noble metals.
They won't react with other.
They won't react. Okay. So what you see here is, see now, there was a small mix-up in this slide. Okay, so please keep that aside and you come back to, yeah, I mean, so there was some, so after this, I was trying to tell you, I did not wanted this, but some technical issue. So anyway, we'll come back and see, homeopathic materia medica, if you know, broadly are classified into modified and unmodified. In unmodified, what do we do? What do we do in unmodified? Symptoms are recorded in patient's own language and no modification made by the author. And the classical example is materia medica. You all know that. And the second very important thing is modified homeopathic materia medica, where the author, once he gets the symptoms from the prover, he modifies them and he rearranges them. Okay. Now examples for modified. Okay, I mean, see, there are plenty. Schematic, anatomical, keynote. I mean, there are plenty. You know all this clinical, therapeutic, yeah, psychoanalytic, picture type, periodic table, combined type. And one thing that is missing is, one material medical that is missing. Comparative. Good, agreed. Combined. Okay, possible. Understanding materia medica through group study. That's what I wanted to tell, and then I wanted to come to metals. It's spoiled the entire thing. Anyway. So, yeah, again it is coming. Okay, fine. That's a different thing. Now, what are noble metals? We'll talk a little about the chemistry. We'll also talk a little about the homeopathic part, and then we'll understand noble metals. Okay? So, as Venkat rightly said, metals that resist oxidation and corrosion in the moist air. They are not easily attacked by acids. Okay? What are the common noble metals? Platinum, palladium, argentum. These are the four commonest noble metals we know and we use. Okay? But Google and the other books, they also talk of ruthenium, rhodium, osmium and iridium. I don't know if the material medica of these remedies are there. At least I have no idea. But we commonly use platina, silver, gold and palladium. And as a PG scholar, these four remedies are there in your syllabus. And they are very important. Okay. So, these metals are expensive. We spoke of it. So it is considered noble because of their value. See, many of us, how much of these we have with us? Okay, for example, how much of gold we have, how much of silver we have, okay, and I don't know, how much of platinum you have. So it shows your social value. I hope you agree. And that's why it is called noble metal. So, and where do we commonly use these things? These metals are commonly used in jewelry. And one more area. Electronic gadgets or electronic appliances, agreed. One more commonest thing from the ancient time, coinage, okay? So you know from our, from the ancient king's time or even before we got into notes, what we had way back as a child is we had coins, okay? So silver coin or even our rupee coin, all those things. So jewelry, coinage, electric appliances to make protective coating and as a catalyst. So these are all the uses. No, important. See, this is just a small build-up. So, this is just a small build-up for you to understand the topic that we are going to discuss. And what I was trying to tell you is, we are trying to understand a group of remedy or a group of remedies through a different way of learning, and that is through group characters. Okay. So now what I was trying to tell you is, why did the concept of group characters come in? So I have just given you a quick background, a quick history. This itself, in detail explanation, might take 60 minutes. But that I feel, for today's class it is not required. But at the same time, you should know, why did this, see, group characters concept did not come all of a sudden. I mean, there was a small evolution. And there was a small meaning, why did this group characters come up? Okay? Hope till now I am clear. Beginners. Okay. So now we will look at the group characters of noble metals. Meaning, the four common metals, noble metals we have: gold, silver, palladium and platinum. So these four remedies, group characters is what we are going to understand. In previous class, one of our PG scholar, she explained metals, if I am right. So metals we have done. So my topic given to me is noble metals. So I will be focusing on that. Okay. Now before I start, to have a small interaction, what are the common characters of noble metals? And before you start answering, we have had a format to make things easy. We have made a structure how exactly we will be studying group characters. Okay, you can answer in that structure or you can randomly answer, no issues. But if you answer through a structure, then possibilities of being missing information will be very, very minimal. Okay. So group characters of noble metals.
Elements from
Okay, elements from?
wounded pride.
Wounded pride. Okay, Dr. Netra has a contribution to start with. Though she is not maintaining the structure, she is giving you elements from. Very good. At least as an encouragement. Good. Wounded pride. Beautiful. All the four. Or we'll see, that is there in the slide, it come up. We'll see which of those four remedies have ailments from wounded pride. Good, possible. Then constitution. Okay, before constitution, there are so many other things. Okay, see, let's not get into the structure part. I know structure should be a little straining. Okay, we'll go with the flow. So Dr. Krishna Das wants to speak on the constitution. Okay, so how are they to look? The noble metals. How are they to look? When I say how are they to look, it is the physical appearance. How are they to look? Lean, thin, prematurely old looking. Lean, thin, emaciated and prematurely old looking. Good, very good. It is there. We look at it. Yes, constitution, ailments. Then this end. Anything else? So first very important thing is, they are all deep acting remedies. I told you, keep it simple. They are all the four. See, when I say group characters, start thinking those four remedies and see what is common in those four remedies, and we are going to put it in an order. All the four. Silver, argentum metal. Gold, you have studied in your UG. Platina, you have studied. And you know there are very deep acting, any mineral for that matter, is a deep acting remedy. So they are deep acting remedy, and you know all the four can be constitutionally prescribed. We have palladium constitution, we have platina, we have silver constitution, and we have gold constitution or our constitution. So there are constitutional remedies and they belong to mineral, you know that, and they are prepared by digestion. These are simple things, but I want it to be in an order, in a structure, that's why I am giving it. Now what I expected from you is this. Spheres. Okay. So where do you see the noble metals acting? Nervous system, beautiful, valid. It's all valid. Yeah, Shilpa, blood vessels. Okay. Circulation, connective tissue, heart. Okay. So we'll, huh? Genitalia, yes, very good. Good, genitalia. So first we'll start with what Venkat was trying to contribute, the vital organs, the brain, the spinal cord, the CNS. There are many remedies which act on the CNS, brain, spinal cord. But noble metals equally have an affinity to act on this structure. Now what do you think it will cause? See, two questions will come up. What do you think these remedies will cause and which are the predominant remedies acting on brain? Okay. So first question, what do you think noble metals cause acting on the CNS? Okay, what pathology? Paralysis, degeneration, paralysis. See, it could be as simple as spasms. It could be as simple as neuralgia. Which is the remedy which causes neuralgia? Which is the remedy which causes spasm? Your search is limited only to 4. So it's very easy. One of you say platina, then you make a small group of 4 and you keep playing. Now this time I have told platina, I will not tell platina, I will tell gold, you tell silver. It's easy. Okay, so the remedy which causes neuralgia, spasms, is more of platina. Platina. Okay, so platina and paralysis. You can see paralysis in platina, paralysis in aurum, and paralysis is also seen in argentum. Palladium we don't know much, but anyway, whatever little I know, I'll just share it to you. So acting on the CNS, the noble metals can cause spasm, paralysis, platina, argentum, met and aurum. They are capable of causing all these things. And very important, again, the vital organ heart. Okay. Any quick inputs out of the 4 remedies, which is the remedy which acts on the heart? Aurum, very good. All of you, one word aurum, very good, agreed. Aurum is a top remedy out of the 4, which mainly acts on the heart. Okay? Increased activity, enlargement and hypertrophy. Increased activity, enlargement and hypertrophy. Okay? So this is the action of aurum on heart, and again, not only the genitalia and the other things, one simple thing we missed is mucous membrane. Okay? Mucous membrane, where? You have mucous membrane in many areas. Where? Very good, J. Not only J, noble metals also have an affinity for respiratory. Mucous membrane of GA and mucous membrane of respiratory tract. Important, okay? So now the question is, which is the remedy which acts on mucous membrane of GA and which is the remedy which acts on mucous membrane of respiratory tract? Argentum, met and J? Respiratory, very good. The first question I asked was J. Aurum and platinum. Platina mainly the lower J. Lower J. Okay. So aurum, platina on the mucous membrane of GA and argentum mainly on the mucous membrane of respiratory tract. And if you want to be more precise on the larynx, put on the larynx, argentum met. Okay. Now this is what many of you were contributing. Genitalia. Okay. So genitalia I have divided it into 2 things. One is we'll look at the ovaries and uterus. Okay. Ovaries and the uterus. Now which is the remedy which mainly acts on the ovaries? Palladium, platinum, argentum, aurum. I told you luckily we have only 4. So your job is very easy. Okay. So I make things very then we'll talk about other things. All the four remedies have an affinity for the ovary. Now, for you to contribute, which are the remedies which affect the right ovary and which are the remedies which affect the left ovary? Palladium and argentum. All of you agree? Argentum, left testis, right ovary. Okay. So argentum, there was a small mix-up, no problem. So a remedy which acts on the right ovary is aurum and palladium. Argentum mainly affects the left ovary and the right testicles. Okay. Okay, so left ovary is mainly platina and argentum metal. So what do you think the noble metal will do acting on ovaries? It can cause two things. One is pain, neuralgic pains, and second thing is it can cause a growth, and that growth is a cystic growth. And noble metals are beautiful remedies for ovarian cysts. Palladium, platina, argentum, and of course aurum. They can cause ovarian cysts. Hope this is clear. Right ovary, left ovary, and coming to the uterus. Which are the remedies which affect the uterus? Aurum. Surprisingly, okay. What do you think aurum will do acting on the uterus? Okay, what will be good? Tumors, fibroids, and yes, the ultimate result is prolapse. So surprisingly, when I was preparing for this class and when I was looking into your repertory for prolapse, all the four remedies are 3-mark remedies for uterine prolapse. Palladium, platina, argentum, and of course your aurum, and all the four are mentioned in your repertory under uterine prolapse. Okay, so aurum can cause fibroid, aurum can cause induration, aurum can cause enlarged uterus, and aurum can also cause prolapse. Okay, so that was about uterus. See, not only prolapse, you also have to remember one more very important thing acting on the genitalia. What these remedies are capable of doing. We spoke of pathology. It causes increased sexual desire. All these things we'll explore a little later. And from your UG and first year PG knowledge, by now you already know that platina has excess sexual desire. We'll explore that area a little later. Increased sexual desire, and then this is what Dr. Krishnadas was contributing. The affinity of noble metals for cartilages. Connective tissue is what he contributed, and if you want to be more precise, cartilages. Okay. Now again, a simple question. Out of the four, which is the remedy which affects the cartilages? Argentum. Argentum metallicum. Okay. So if you read argentum met, it is beautifully explained that it has an affinity for joints, mainly the cartilages, larynx cartilages, and that's how argentum can also be a very good remedy for ankylosing spondylosis, because of its affinity for cartilage. Okay. Then osteoarthritis, joint affections, argentum, and surprisingly, your repertory, when I was checking for today's class, induration of cartilage. Not only inflammation, the cartilages can go into hardening and thickening. Only two remedies mentioned. And both the remedies are from the noble metals, argentum and aurum. Argentum and aurum, indurated, thickened cartilages. Okay? So moving ahead, what you also see here is its affinity for bones. Remedies for bones, aurum, top remedy. But you can also see argentum met affecting even of scale. But aurum is the most what commonly indicated noble metal which has an affinity for bones. What will aurum do acting on bones? Caries. Good. Caries. Necrosis. And any quick inputs, which are the bones aurum is capable of causing caries? Very good. Nasal. Facial bones. Okay. Ossicles. Ear. Right? Okay. Palatine bones. So nasal, palatine, mastoid, etc. by aurum and many of you shouted when I spoke to you about spherofaction, and that is glands. What are the glands commonly affected by noble metals? Ovaries, testicles, liver, thyroid, lymphatic glands. These are few glands that you can see noble metals affecting. And the top remedy here again is aurum. Aurum having an affinity for glands. Now what will aurum do? It can cause congestion or it can cause induration. Both are possible. Congestion, induration. Okay? And another remedy that can affect glands will be argentum met. And it can, because ovaries, you can also have palladium and you can also have platinum. But wide range of glands are affected in aurum. Okay? Now, before I take up the next spherofaction, or what is it that we are trying to talk here is, we are discussing the generalities of noble metals. We identified the noble metals, some 8 noble metals, and in that we also realized in homeopathy commonly we use 4. And which are those 4? Aurum, silver, argentum, platina and palladium. And they possessing them or having them will add value to our status. Okay? Right? So that's how you become noble. Meaning, having more of this will make you more rich or you'll have more of position in the society. Okay? And we quickly looked at the spherofaction. We also realized all the 4 are deep-acting remedies and they are constitutional remedies, they are polyclast remedies. So they can act on any part. But last few minutes we realized or we understood the common affinity of these remedies. It could be CNS, it could be heart, or it could be the glands, the male, female genitalia, the mucous membrane, and many more areas. Okay? So beginners, any quick questions? Anything, any clarification, any questions? So if you are clear, what we'll do is we'll go ahead and we'll definitely come back for the question and answer session. Now the next component we'll be discussing will be ailments now. What are the common causative factors of noble metals? Okay? So what are the common causative factors? Nether will contribute 1. Okay? Disappointment in love. Which are the noble metals which can go into disappointment in love? Aurum. And platina aurum from your books, from your source books, 2 remedies. Okay? Ailments from grief. Okay? Ailments from fright. Okay? We'll go with the PPT. Ailments from grief. Ailments from disappointment in love, which we just discussed. Ailments from sexual excess. Okay? Argentum. Platina. Okay? Ailments, naturally we are talking of sexual excess. Ailments from masturbation. Okay? The other remedies you would like to think of here. Tetracycline, selenium. We spoke of selenium in the last class. Agnes. Correct. Agnes Beretta. What will happen in Beretta? Beretta, bad effects of sexual excess. What will happen in Beretta? J complaints, Eye complaints. Okay, eye complaints. We spoke of before, and when do you think of ambraglacia in except Netra and Shweta, others have made answer. When do you think of ambraglacia for bad effects of masturbation? Ambra. Even Venkat. They heard it, so let them not reveal the remedy. If I were told only Venkat, I am giving you a very good clue. To confess you, I have also included Netra and Shweta. So you will be worried, what is it those three attended and what is it that thing is? So that is a clue. Huh? If it was only Venkat, then it was a different scenario. So Netra and Shweta also are excluded. Okay, what is the remedy? What was the situation? Bad effects of masturbation, or when do you think of masturbation as a complaint? Or when do you prescribe Ambra for bad effects of masturbation? Huh? Yeah, I heard some noise. What? Guilty. Two of them are shouting guilty. Now what is this? What is this? I was also sharing a small case with them a few days back. A person, tomorrow in your clinic you have this situation where a person comes to your clinic, he is very masturbating, and then he feels guilty of the act. Sir, I want to get out of it, but I am not able to get out of it, and please do something. I feel very bad, very sorry that I am doing this, and he feels guilty. And he is not able to get out of this. Okay? One beautiful remedy is ambraglacia. Another remedy? Acid phos. Yes, good. Phosphoric acid. Good. Phosphoric acid, ambraglacia. Right? And ambra, is mainly a remedy which is introverted, shy, timid, embarrassed. Okay? And acid phos, when out of all this they go into weakness, tiredness, loss of vital fluids. That's more of an acid phos picture. Okay? Bad effects of masturbation, fright, platina, aurum. And this is what can somebody quickly interpret the image? Loss of position. And this is what Netra also was trying to start off the conversation. What is it? Honor wounded. Okay? So when somebody's position is lost, how they feel, what they feel is also very important. In the noble metals, I will be talking this in detail when I tell you the mind. In noble metals, the feeling is the feeling is their pride has been affected. Okay, honored pride. Right? Wounded pride. Are their honor rating affected? Are their honor rating wounded? So loss of position or pride rating affected, or their respect rating affected. And if you are looking at the physical process, till now we spoke of the mind, except for the masturbation part. You also have tobacco and mercury. And when you read aurum blood picture, mercury is something that keeps coming on and on. And when you read platina, you have tobacco. Okay? Even in Argentina you have tobacco. So these are all the common elements of noble metal. And last few headings, and then we will close the introduction. And next class we will talk about something more interesting. So under the heading introduction, we introduced noble metals. We spoke of sphere of action, preparation, okay, and then we spoke of element stone. So what are the few headings left out under the introduction? We have physical appearance, which Krishnadas has made it very clear for you. Apart from physical appearance, you also have Mayasana, very good, and then you also have diathesis. Okay. Diathesis, and we can also discuss thermals. Okay. So diathesis. What is the diathesis? Scrophulus. Good. See, you don't have hemorrhages. I was just checking before I commit to you people. I was checking more of an affinity for plants. So the diathesis will be scrofulous. Diathesis will be scrofulous. And then you also have the miasm. What is the miasm? Psychosyphilitic. Predominantly syphilitic, but you see a lot of growth. You see tumor, you see cyst. When you see the pathology. So psychosyphilitic is the miasm. And then the last part which was covered is beautifully covered, completed, I have nothing to add here. Lean, thin, emaciated and prematurely old looking. Old looking. Okay? So when you look at the thermals, when you look at the thermals, platina, hot, argentum, met, aurum, chili and palladium, chili. Okay? Palladium, chili or not? Okay, palladium will explore, but from the information we have, chili. The only noble metal which is hot is platinum. For time being. Okay? So, what we did as a summary, as a sum up, as a revision, we did list the noble metals, okay? And then we looked at the spiral action, okay? And then we looked at the ailments from, and under one heading, we understood the diathesis, miasm, physical appearance and thermals, okay? So any quick questions, any clarification or any additions as a PG scholar, if you have anything else to contribute? Okay, no issues. And then for tomorrow or for the next class, whenever it happens, we'll be looking at the physical generals, we'll be looking at the mental generals, modalities and the clinical indications. Once I am done with this, then individually I will be taking up those 4 noble metals. We have beautiful cases of those 4. I have not used argentum. Must be if you can contribute your experiences when I start argentum. Argentum, I don't have many cases. Okay, but palladium, platina and aurum, we have beautiful cases. So we'll try to understand each remedy with cases. So that as a PG scholar, you can explore these remedies more often in your practice tomorrow. Yeah? So I plan to finish this in the next class, okay, so that we can take the other remedies. And one more important heading we can also include here is how to differentiate these 4 noble metals. That will be challenging and that will be interesting. Okay. How to differentiate aurum from platinum or aurum from silver and platina from palladium. So must be 10 minutes, we can have a small activity and we can try to give 10 permits in the next class. We'll try to finish this. Okay? All fine? Okay, any questions? Sir? Okay, sir. Thank you. Thanks.